illness. Psychiatric disorders. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is that associated with old age, senile dementia. Disorders in which there is no obvious pathology or anatomical change in an organ are termed functional. These are described below. Substance abuse. Abuse of a substance means using it in a way that is harmful. The commonest form of substance abuse are alcoholism and drug abuse. Affective disorders. There is an extract from a medical textbook. Affect and mood are similar in meaning and refer to the emotions. Affect tends to be used for temporary emotions and is expressed through manners of speaking, facial expression, or behavior. Mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression. The symptoms in which are poor appetite, or significant weight loss, sleep disturbance, and fatigue. Psychomotor agitation or psychomotor retardation, loss of interest in stimulating activities, decreased ability to think and concentrate, feeling that one is of no value to others, or that one has done something wrong, recurrent thoughts of death and suicide. Five or possibly four of the above symptoms occurring nearly every day for at least 2 weeks constitute a major depression. Neurotic and stress related disorders. An example of neurotic disorder is obsessive compulsive disorder. An obsession is an idea that is so persistent that it interferes with the patient's life. A compulsion is an obsessive idea that forces the patient to act even though they recognize that it is unnecessary. A common form of this is compulsive washing of the hands. Stress is a feeling of being unable to cope. It can lead to anxiety or fear of problems. A sudden attack of anxiety is called a panic attack. Other types of functional disorder, these include behavioral syndromes associated with physiological disturbance, disorders of adult personality and behavior, mental retardation, schizophrenia, and other disorders in which there are delusions. Enfermedad mental. Trastornos psiquiátricos. Los trastornos psiquiátricos se pueden dividir en orgánicos y funcionales. La demencia es un trastorno mental debido a una enfermedad cerebral orgánica. La forma más común de demencia es la asociada con la vejez, la demencia senil. Los trastornos en los que no hay una patología evidente ni un cambio anatómico en un órgano se denominan funcionales. Estos se describen a continuación. Abuso de sustancias. Abusar de una sustancia significa usarla de una manera que resulta dañina. Las formas más comunes de abuso de sustancias son el alcoholismo y el abuso de drogas. Trastornos afectivos. A continuación se muestra un extracto de un libro de medicina. Afecto y estado de ánimo tienen un significado similar y se refieren a las emociones. Afecto suele utilizarse para emociones temporales y se expresa a través de la forma de hablar, la expresión facial o el comportamiento. Estado de ánimo se utiliza para referirse a un estado de ánimo emocional más permanente. La forma más común de trastorno afectivo es la depresión, cuyos síntomas son la falta de apetito, pérdida significativa de peso, alteraciones del sueño, fatiga, agitación psicomotora o retraso psicomotor, pérdida del interés en actividades estimulantes, disminución de la capacidad de pensar y concentrarse, sensación de que uno no tiene ningún valor para los demás o de que ha hecho algo malo, pensamientos recurrentes de muerte o suicidio. Cinco o posiblemente cuatro de los síntomas mencionados anteriormente, que ocurren casi todos los días durante al menos 2 semanas, constituyen una depresión mayor. Trastornos neuróticos y relacionados con el estrés. Un ejemplo de trastorno neurótico es el trastorno obsesivo compulsivo. Una obsesión es una idea tan persistente que interfiere en la vida del paciente. Una compulsión es una idea obsesiva que obliga al paciente a actuar aunque reconoce que no es necesario. Una forma común es el lavado compulsivo de las manos. El estrés es una sensación de incapacidad para hacer frente a las cosas. Puede provocar ansiedad o miedo a los problemas. Un ataque repentino de ansiedad se llama ataque de pánico. Otros tipos de trastorno funcional incluyen síndromes conductuales asociados a trastornos fisiológicos, trastorno de la personalidad y del comportamiento en adultos, retraso mental y retraso en el desarrollo mental, esquizofrenia y otros trastornos en los que hay delirios. Chapter 25 Mental Illness. Complete the table with words from A, C, D, and E opposite. Noun, adjective. Noun. Affect, anxiety, behavior, dementia, disturbance, suicide. Adjective, affective, anxious, behavioral, demented, disturbed, suicidal. Make word combination using a word from each box. Two words can be used twice. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Complete the sentences. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia. A disorder which is not associated with pathological changes is functional. An idea which forces a patient to repeat unnecessary action is a compulsion. Which symptoms of depression was this patient suffering from? Look at the opposite to it. Case 41. A 56-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was pacing urine more often. She was eating normally and her weight was steady. Tiredness, loss of interest, sleep disturbance.